Kerryn, what symptoms are we talking about here?
We're talking about symptoms of many respiratory viruses, similar to, for example, influenza, para-influenza, respiratory syncytial virus and COVID. And so it can be difficult to tell between them symptomatically, particularly in the early stages of the infection. And it's one that we do look out for. It's particularly difficult for people who are in the more vulnerable groups like young children, people who are over 65, people who are immune compromised. And of course they can get complications. The complications can include bronchitis, bronchiolitis, pneumonia, which might need further treatment. Some people end up in hospital and it is possible to die from this virus, but most cases will be less severe than that and you can get it repeatedly.
Is it easily transmissible? Is it very contagious?
It is transmissible, and it is, yes, so that means it is contagious, and it's contagious in the same way that other respiratory viruses are contagious. It can be spread by being coughed or sneezed on by somebody who is infected, and it can also be passed on through touching infected surfaces. And so it's very important that we maintain all of the things that we know that will help to prevent airborne or respiratory viruses, like being careful with hand hygiene, wearing a mask, particularly if you have symptoms. It's important in crowded indoor places when you know that there is an upsurge in a virus like human metapneumovirus, which there is reported in New South Wales at the moment, to wear a mask when you're going to be, particularly in a crowded indoor space. I think it's very important to wear a mask if you have any symptoms and you're going to be around other people. And of course it's very important that you stay away from other people if you do have symptoms of a respiratory infection, because you don't know whether the infection that you have is likely to cause severe illness or even death in another person who is vulnerable.
Kerryn Phillips, thanks so much.
Thanks, Waleed.